Have some bad news when it comes to the coronavirus pandemic, but there are some encouraging signs as well in this final week of 2021. Western New York 7-day positivity rate continues its gradual climb, and it's now up over 10.5%. The Finger Lakes region, which includes Genesee, Orleans, and Wyoming counties, is closing in on 9.5%. The state average now up over 13%. Now, the good news, take a look at this chart. You can see a significant decrease in the number of COVID-related hospitalizations in Erie County, a significant decline over the past couple of weeks. The Erie County Health Commissioner is also urging people to wear high-quality masks. KN95 masks are recommended because the Omicron variant is 2 to 3 times more transmissible. This is especially true for people who travel or use public transportation, people taking care of someone with COVID-19, people with public-facing jobs, and people who are not vaccinated. Reporter Ryan Arbogast tonight has more on what Erie County officials are saying about COVID-19 and the upcoming holiday weekend.
The message from Erie County Executive Mark Poloncarz this week is clear. Think about staying home.
We know that the New Year's Eve holiday is a big holiday for many, and they like to gather together. This might not be the year to gather together for New Year's Eve. You might just want to be quiet at home with the family because the Omicron variant is here.
The county executive and the county health commissioner, Dr. Gail Burstein, are expressing concerns over Omicron, now the most dominant variant in Erie County.
Omicron didn't just come here last week. It's been here since at least December 10th. Most of the new cases, a majority of the new cases that people are catching in this region are Omicron.
Cases are up almost 50% since last week.
The Omicron variant that we have here, that is the dominant strain now in Western New York, is very, very transmissible. At least 2 to 3 times more transmissible than the Delta variant, which was more transmissible than the Alpha variant, that was more transmissible than our original variant that we had of COVID-19.
Even with more cases, fewer people are going to the hospital in Erie County, and more beds are becoming available. While researchers say Omicron is more transmissible, the risk of hospitalization is lower.
We implemented the mask mandate to prevent our hospitals from being overrun. It is working. It has continued to work.
A trend in Erie County, one that Poloncarz says for now will keep a vaccine mandate on the sidelines.
We're comfortable in staying in phase 1 with the continued decline of hospitalizations and more beds opening up.
County officials say they expect a continued uptick in cases, but hope hospitalizations stay down as people continue to move indoors and gather during the winter. Ryan Arbogast, 7 Eyewitness News.
All right, so there's a lot to digest, right, when it comes to the pandemic this week. The CDC's new isolation guidelines released just yesterday. On top of that, the flu season. I asked Dr. Nancy Nielsen about those subjects this afternoon, but we started with her thoughts on that local drop in hospitalizations.
We don't know that yet. We know that Omicron arrived here in Western New York the first week of December, and we know for sure that it has exponentially increased since then. So what we do know is that the number of our cases are going to go up. No question. It's just so much more contagious. However, as you point out, the hospitalizations are down, and that's a good thing. We've seen that in South Africa. We saw it in the UK, and we are hopeful that adults will not be hospitalized as often. As many adults will not be hospitalized as happened with Delta, which was a bad variant, that's for sure. But on the other hand, the admissions with COVID to Children's Hospital, to Oishei Children's, have gone up. And we are seeing that across the country. So I would say that in the next 4 to 8 weeks, we will know whether this virus is going to sweep through. And as the former Surgeon General said, he said, everybody's going to get Omicron for Christmas, vaccinated or not. And it's a matter of how sick are you going to get when you get it.
With all these cases coming, right, this wave of new cases coming in the Omicron variant, the CDC yesterday announces that they have cut down the isolation, reduced the isolation in terms of to down to 5 days. Are you surprised by that? And why now with cases going?
Well, what we've learned is that the Omicron variant is so much more contagious and the incubation period is shorter. It was with the other variants about 5 days. It's only 3 days here. So we know that it is probably considerably safer at 5 days than it was earlier in the pandemic when we were dealing with other variants. Nothing is foolproof, obviously, but frankly, with the number of cases that are occurring across the country and that we expect to continue, you can't have the country shut down with everybody out, isolated or quarantined for 10 days.
And while we're dealing with all of this, flu season is upon us. What do we expect from the flu season?
It depends on how we behave. We already have flu here. The county health commissioner in their press conference today announced that they've already had some positive flu cases. So we get flu every winter. It's a matter of how we behave and how much congregation we do with other people in ways where we are not protected, like by wearing a mask.
And we thank Dr. Nielsen for her time this afternoon. Also tonight, the University of Buffalo is the latest school to require kids to be vaccinated to attend athletic events. Starting Saturday, all kids age 5 to 11 need at least one dose of the COVID-19 vaccine. That's to attend men's and women's basketball games, plus swimming, diving, and wrestling events. By February 1st, they need to show proof of a completed vaccine series to go to those athletic events.